Back to the channel. Today, we're going to talk about a mental health condition that many people misunderstand, OCD, or Obsessive-Compulsive Disorder. When people hear the word OCD, they often think it just means being neat, organized, or a perfectionist. But OCD is much more complex than that. It's a serious mental health condition that can deeply affect a person's everyday life. OCD involves a pattern of unwanted thoughts, fears, or urges. These are called obsessions. These obsessions cause a lot of anxiety. To try and relieve that anxiety, a person might feel the need to perform certain behaviors or rituals over and over again. These are known as compulsions. The cycle of obsessions and compulsions can be exhausting and time-consuming. For example, someone might constantly fear that something bad will happen if they don't wash their hands a certain number of times. Another person might need to check and recheck doors, lights, or appliances, even when they logically know everything is fine. It's not about being overly careful, it's about feeling trapped in a pattern they can't control. OCD isn't something a person can just get over or stop doing. It's not a choice. It's a real disorder that affects the brain and behavior. And while the symptoms may look different from person to person, the one thing that's always present is the level of anxiety and distress it causes. The exact cause of OCD isn't fully known, but researchers believe it's related to a combination of genetic, neurological, behavioral, and environmental factors. It can start in childhood or adolescence and often continues into adulthood if not properly treated. The good news is that OCD is treatable. The most effective treatments include therapy, medication, or a combination of both. One of the most common therapies used is called cognitive behavioral therapy, especially a type called exposure and response prevention. This helps people gradually face their fears and learn to reduce their compulsive behaviors. Medications like certain antidepressants can also help by balancing brain chemicals involved in mood and anxiety. If you or someone you know struggles with obsessive thoughts and compulsive behaviors that interfere with daily life, it's important to seek help. Mental health professionals can provide the support and treatment needed to manage OCD and live a healthier, more peaceful life. Let's also remember to show kindness and patience. OCD isn't something someone can control with willpower alone. By spreading awareness and understanding, we can reduce the stigma and help more people get the help they deserve. Thanks for watching. If this video helped you understand OCD a little better, please give it a like and consider subscribing for more mental health content. Take care of yourself and others, and I'll see you in the next video.